With all the talk about flattening the curve, have you ever wondered how that curve is even created? Joining us now, Dr. Jonathan Mack from the University of San Diego to explain more. Good morning, doctor.
Good morning, Shelley. Thank you for having us on this morning. This is really an unknown territory that we're in. I think we're definitely getting results from everyone staying at home and observing those restrictions. It's not clear when or how we'll open up and allow people out of their homes and be able to socialize again. We know from prior epidemics, especially the 1918 Spanish flu, when they relaxed some of those confinements, they saw a quick spike in number of infections. Until we were able to determine exactly how many people out there have already been exposed and potentially have antibody protection, and that's going to take mass testing of individuals. We're not really going to know for probably another month or two if we're going to see that flattening of the curve.
When you talk about these numbers, I was actually thinking about this today. Driving in, I was listening to a really good podcast, and I was wondering myself, how accurate are these numbers for the curve? Is there a database that everybody all across the United States are putting in, and then you compare it to really the numbers that are all over the world, and you see some big differences?
Yes, there are. Not everyone is collecting data from the same sources. The federal government, local agencies are reporting up to the federal government, the CDC, but there's variations in interpretation as well as the models. You've probably seen some of the projections change over time. That's based on the model that's developed on that data sets that they're using. You know, and the projections are only as good as the data that we have at that particular time to develop them.
The projections now that you were talking about, it looks like San Diego is on a good track because of all this social and physical distancing, which will bring me to a question that you kind of touched on the answer. If we are being successful in flattening this curve a little bit, everybody staying home, the second that people start coming out again and we start mingling with each other, that could change everything again.
Absolutely. We still don't know how long the COVID virus has been circulating out there. There's some theories that we may have had some exposure prior months or maybe even a year. We just don't know if it's been circulating in the United States. So there are some studies that are just beginning trials up in UCSD to do antibody testing on the local population to see how many people are infected. I suspect that the White House, when they lift some of the restrictions, I can see us continuing to wear masks as we're out in public and avoid certain types of travel. But until we actually have a vaccine to protect the population, this is going to be with us for some time.
Yeah, we have heard that time and time again, and I think it's still hard for some to process. Dr. Jonathan Mack from University of San Diego, we appreciate your time.
Thank you so much.